Welcome to the office.
Hey, Ray.
Hey,
Welcome, sir. Welcome to the office.
thank you.
So, what brings you here?
My lower back, excessive pain, chronic pain, I guess you might want to call it.
You've had it for a while right
A
now.
while, yeah. I've grown to tolerate the pain.
Okay, and this is an old work comp injury that the case has been closed out.
Yeah, I'm done.
And you're here for actually, hopefully, to get some relief now.
Yeah, that's about it.
Right?
Pretty much sums it all up.
All right. And it hurts to keep your head up, or you're just
Yeah.
used to it? Body's tired, body's in pain.
Yeah, exactly. I'm torn and worn.
And what were you doing? What was your job?
I staged houses
Okay.
for my movie furniture, you know.
So a lot of lifting, a lot of bending, a lot of
Yeah,
twisting, a lot of
yeah,
physical activity.
Yeah, everything from medium to heavy weight, you know, it all depends.
And sport, before this even, did you play sports?
Yeah, I was a pitcher in high school. I threw pretty hard, and I think maybe that was the start of the of all my body ailments.
Okay, but 2019 is when
and
it
then-
really went
yeah.
off, right?
Yeah, that's when I've always had, when you work, you get a sore back, but I've always managed to go home and, ice it, heat it up, boom, ready to go back to work. It was normal for me.
This
And
time?
This time I knew right away. It wasn't necessarily pain, it was like a jolting,
Sharp,
electric
volt almost, right?
That it scared me, if anything, and then after I realized I could feel the pain, but
Did anyone tell you surgery?
No, they said. Well, I told them I didn't. I want to exert all my other options before we even go there.
Okay.
Because I have a friend that he's like stage 5, and he told me stay away from surgery.
All right, so the number one complaint is the low back pain.
Yeah.
It's going down your legs?
Yeah, and then halfway mid up my back, everything just.
Seizes?
Yeah, it just.
Is it now this is important, does it spasm or seize?
It seizes. And then it just like locks, and I get into this position,
Forward position.
Yeah, it's like forward position. It's, like I don't like going shopping,
Because you don't know what's going to happen.
I don't last very long. 2 aisles, I'm done. 2 aisles, I'm done. Yeah.
Well, let's get to work then, okay? And we can talk about more stuff later. Right now, let's get you some pain relief. Let's get you moving.
Yeah.
And let's figure out what we're going to do.
That'll work.
I'll see you about 3 visits, okay?
Okay.
End of the 3 visits, we'll make a plan.
That'll work.
All right?
That sounds good to me.
Let's go over here. Let's look at your film, sir. So in this position, what it shows is you're antalgic. You're leaning away from your back pain, right?
Yeah.
Now, let's go a little closer and let's take a look and let's see the shape of these discs. And if we look at this L4, so you were told L4, L5.
Mm-hmm.
Now, if we look at L4 and L5, yes, they are less. If we want to say degenerated or worn out, yes. But here's at least some good news. There's still decent disc here. So if we can stop further progression of this, that's a good sign. Number 2 is here at L4. Now, the thing that's concerning to me with L4, we're starting to get a little lucency line starting through the disc of L4. That slight lucency is called a vacuum cleft sign. A vacuum cleft sign means that it's dead tissue where there's no oxygen going there. And if there's no oxygen or nutrients going there because it's what? It's not moving.
Yeah.
So the goal is we got to get things moving. So 5, 4, 3 is also, you can see, wearing out a bit. We'll follow it up. And then what 2 is doing here, look. So 2 and 1 up here are doing what? They're trying to fuse. You're getting those little hooks there, okay? All of that is because of instability. You have what we call the poker spine. It's a very straight spine. We don't have the right curvature. However, in your case, I don't know yet. We'll see down the road. Because the curves aren't there, but your posture is also antalgic. So part of the way this looks is because you're leaning away from pain.
Yeah.
So I'll probably do a spot shot later after a few adjustments to see what shifted with you, okay? All right. Now, the next thing we see is this. So we don't have the right curve. And then from the mid-back forward is all hunched
Hunched back.
forward, right? So all these muscles here, they're all working overtime just to
Yeah.
hold you
Oh,
upright.
yeah.
So you're in the seesaw battle between back pain and tightness.
Yeah,
Does that make sense?
Correct.
Right? Let's go back to now the foundation. And what we see here is this, and this is what we need to now investigate. We have a few things going on here. We have a rotated sacrum on the right. It is dropped 2 millimeters on the left, and we have a little bit of rotation on the left pelvis. But here's the thing I want us to see, dude. Whatever happened here between 4 and 5, you see how it's whiter here, thicker, the bone?
Mm-hmm.
This is Wolff's Law. Bone will grow according to the demand placed on it. Look, we have a short leg on the left, and we have a sacrum tilted on the left, but we have the curve of the spine curved on the right. So your body is just trying to figure out how to be in balance. Now, if we have a sacrum issue, we're not going to do L5 first. We're going to have to do the sacrum first. But we're going to examine you and see what we find, okay? So from all of this, what do we see? We have a rotated sacrum. We have an L5 issue on your foundation. There's a little bit of rotation on the pelvis. I'm not so excited about that right now. Okay? Now, let's continue up. And what are some of the things we can see? This is all compensation, brother.
Yeah.
All of this
it
is
looks like a crooked Christmas tree or something.
It's a little off. We also have a left jaw issue. Sorry, right jaw issue, left compensation.
And I got a pop in my neck.
And we'll deal with that later, okay? Right now, the focus is the back, okay? For the first 1 or 2 visits.
The jaw, huh?
Yeah, your jaw pops on that left side.
I used to be able to do that.
Yeah, your jaw pops on the left side. How do I see that? Yeah. You can see the jaw deviate from the right side to the left. You can see the ramus of the jaw is thinner on the right, thicker on the left. The thicker side is the compensation side. And
wow.
I talk a lot about that on other videos. Okay, you ready to get started, sir?
Yeah.
Turn your whole body. Okay, so first thing we can see is he's hunched over here. So we want to, what happens if you straighten?
Oh, I feel tighter.
Where? Here?
Yeah.
Okay. Let's go ahead and walk to the corner of the room, please. Turn. And you're going to do this about 3 times. Walk to the corner of the room. And you're going to walk, keep going. And you're local, you grew up here, right?
Yeah. San Gabriel Valley. This gets me tired, believe it or not.
Just doing that?
Yeah, I can't even walk a block.
All right, come back over here. Let's get to work. All right. L5. Ooh, we got another special listing. We got all kinds of special listings. That's one of the things I love about this Gonstead work, you know. L5 special listings. And I don't know a lot of other people that know about it. And we'll talk. He has an L5 PRS-M. Starting at the base of the neck. And the first thing we're getting is left C2, 15 points, around C1, C2. Next thing we're getting, now this was good. It looked like it was going to stop here, but it doesn't. It looked like it was going to stop there. It didn't. Keeps going back and forth.
What's going back and forth?
It's not breaking, meaning it's all compensation, brother.
Well, I haven't gotten nothing.
Does it hurt more if you bend to the left or the right?
I find myself in my car, sitting like
To the right?
Yeah.
And that if you go to the left, it hurts.
And no, it's just I just don't feel normal. I don't know. I feel like I'm like this all the time. You know, I don't know.
Alpha.
It doesn't hurt, but I just the position just doesn't feel right to me.
All right, let's confirm with the digital scope. And let's see if anything is different. C1, C2. Bringing the thermocouples a little bit closer. That's just chatter. That didn't stop. Chatter. Bring them a little closer in the lumbar spine. Why? That's a good question, guys. Why do I bring the thermocouples or the probes closer in the lumbar spine? And I have to widen them for the thoracic and cervicals. So similar, it's a lot of fluttering. This is all compensation. We're getting L5 and we're getting up top around C1, C2 on the left side. Next thing we're going to do is static palpation, and what we can see, the swelling edema starts here. It pulls through the middle.
Oh, that feels kind of good.
It doesn't stop. Starts to pool there. That feels good, you said, right?
Yeah.
But then when we get about here,
Yeah.
now the pain, it's all tight.
Oh, yeah.
This whole thing is stiff.
I'm wound up.
This part of his tissue, this is soft. The fibers are soft. Now it gets taut and tender. Okay? And I'm not even going to push hard, but you can see all that right there. Okay. That's the tailbone, sacrum. That's the right sacrum. That's the L5. L5, tender, yes? But we have that sacrum also to deal with. So, back towards me.
Oh.
Right there.
Oh.
5. Sharper. Yes. Sharper. 5 is tender. 1 more tender. 2. How about 3? Yes.
Yeah, okay, I get the
How
point.
about 4?
I get the point. Yes.
How about 5?
Yes.
It's all tender. Okay, I'm sorry, brother. I had to do it. Okay. Stand up for me, please. And walk once and let's get started. Now, I'm not doing too much of the physical exam with him because he just can't handle it. This is an acute case. Slide up a little bit, please. That's it, that's it. I'm doing the neck here, okay? Chin down. Chin down, look down, look down. There you go. Now let your body just kind of fall into the table. There you go. Gotcha. Good. We're gonna do this on the side, dude. I don't think he's gonna handle the first one in this position. And the reason why is this. He's leaning away from it this way. If I push him in extension, he's not going to be a happy camper. Come off slowly. We'll get there, but not today. Hold my hand, sir. And let's walk once. That was just C2.
Oh, wow.
What?
I don't know.
You can hold your head up a little bit.
A little bit, yeah. Oh, yeah. That's weird.
What's weird? Tell me.
Well, I figured I'd hear something pop, but even though it didn't pop, my eyes are up.
Oh, you think it's about the crack?
Yeah.
It's about the clunk. It clunked in there. It's set. Walk it up.
Wow.
Walk it up. We're going to do this sacrum rotated and valve side down around S4, S5, okay? I need you to roll your whole body forward. Perfect. Bottom leg nice and straight.
I'm sliding off.
I got you, brother. Don't worry. I got you. I got you. You okay there? You okay?
I'm trying to relax for you.
Don't try. Do it. Let's roll. Come forward. I won't drop you. I got you, okay? I got you. All right. So we're gonna do this as a finger push down at S5 straight through. I need you to look up a tiny bit. Not at me, that way.
Oh, that way.
Keep your head straight. And let it roll. Let me roll you. I got you. Take a little more time in the setup. Make sure the patient is relaxed. Become one. You good now? You see that? You shouldn't even flinch if I do this, okay? Let it roll.
Oh!
That's a piece. I got you.
Oh!
Gotcha.
Oh! 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 Thank you. No. Oh! Oh!
We got you. We got you. You're okay.
I know I'm okay. I just want to cry. Oh man. Oh.
Take your time. You want to roll to the other
Can we
side?
do that again? I'm just kidding.
Get on the other side, will you? Come over this side. Can you turn to your other side?
Yeah.
Take your time. Take your time. Take your time. Nope. Take your time. Now come off the table. Slide forward. What? Time out?
Okay, I'm going. Oh.
Okay. If it's easier to roll, I was just seeing if you could do that.
I never used to be able to do that. It's just from just practice.
Swing your legs down. Push yourself up. Push yourself up.
Like
Yep. Get up. Take your time, brother.
Now what?
Get up.
Oh!
Stand up. Go walk. Check it out. All right. Give it a minute. Hey. That's cool. Got up a little easier.
Who needs drugs? Oh man.
Dr. Rahim, your anti-drug. Or, as we used to have shirts, Chiropractic, my anti-drug.
This feels good.
Feels better?
Yeah.
Good. It was down at S5. Down in the basement.
Yeah, that's where the problem starts.
Look at that little smile. I want you to come back over here and let me check you, sir. Good stuff.
Oh,
¿Qué pasó?
oh, that was easy to do.
It was easy, right?
Yeah,
Easier.
Easier, yeah.
Head down. So I've been showing the difference between this porcelain scope and the digital scope. And no, I am not getting rid of my porcelain scope, guys. Someone's asking me for it. People are asking me for it. And as I said, no, this is like my class. It's like a classic Rolls Royce, dude. You don't get rid of this. Even if it's broke, you don't get rid of it. Clarissimo. That means clear for you guys that don't know. Mira. Sacrum, S1. This was your L. This is your L5. You remember?
Yeah.
Mira.
Oh.
Mira. 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 Yo, man, we're not that close yet.
Come on, I can't laugh.
Go up.
Don't make me laugh.
Uno. Come on, don't be scared. Don't be scared. Bueno.
Oh,
Número dos. Come on. Don't be scared. Don't be scared.
I can do sit-ups?
No, you're not doing any sit-ups right now. You're just gonna walk. You got a dog?
No.
Mira. Cuatro. Number 4. S4 and S5. That's where we're gonna start, brother. I'm gonna do the buff and polish now. Let's break up some scar tissue.
I haven't been able to laugh for a while. I wanted to laugh.
What's that?
I haven't been able to laugh, or I mean, when I laugh, it hurts, but not.
A little less now,
I
right?
used to get mad when people would make me laugh. So that.
Tell you jokes. You don't like going to the joke
No,
factory?
I'm not jokes through my own self, but I just haven't been cracking any jokes for a while. Nothing's been funny.
Wayne, this is vibration therapy, guys. This isn't percussion. And the idea with vibration, the magic frequency, it's 10,000 RPM vibration. It breaks up scar tissue. When you go over normal tissue, it does nothing. So it doesn't feel, it just feels like a little buzz. When you go over scar tissue, you feel that little tickle spice, right?
Yeah.
A little tickle spice. There you go. Walk it off.
I get tired after 30, 40 steps.
Let's walk. Keep your head up now. We have to change that habit. Head up, here. Turn, keep walking. So what you're gonna do, sir, you're gonna walk down, you're gonna walk a block. You're gonna walk down to the stop sign and back
Right now?
after we're done.
Okay.
And you're gonna come back and let us know that you walked the block.
Okay.
All right?
Yeah.
He's
I can do it now.
Yeah.
Because usually when my first 4 or 5 steps, I'm already
Keep going.
wound up.
Keep going.
And it's easier to keep my head up.
Right on. That's where we're gonna start with you, okay, sir?
That'll work.
Come
That's
over
great.
here, check your hands.
Oh no.
What? Come here. What?
Nothing.
You don't want me to do your hands?
Yeah, go
I'm
ahead.
just-
I know actually,
I'm
yeah,
just
I'll
checking.
just, look, if you look at my hands, this one's swollen.
I'm just checking, brother. Squeeze. Your power is there. Squeeze.
Yeah, my right hand's not.
That's coming from the neck. Squeeze.
Surgery.
Squeeze. Okay, we're gonna wait on this.
Yeah.
All right, we're all set for today.
Thank you.
You're gonna
I
go for,
appreciate it.
You're welcome. You're gonna go for a nice 1 block
Yeah.
walk. You're gonna come back and report to us that you were able to walk a block.
Yeah, I'm gonna do that right now.
All right.
Thank you.
Questions?
No, I'm gonna save them for later.
Welcome to the office.
Thank you.